The Republican tax plan poking holes in the Affordable Care Act by repealing the individual mandate, but not yet fully getting rid of the law. President Trump, though, thinks Republicans and Democrats will come together and agree on a plan to ultimately get rid of Obamacare. So is he right? Here now is attorney and former policy advisor and spokesperson to Governor Jeb Bush, Justin Sayfie. It's a simple question, Justin. Is he right?
I think he is right, absolutely. And look, the individual mandate forced Americans who did not have health insurance to either buy or pay a penalty to the federal government for not purchasing health insurance, and they got nothing in return. Millions of Americans did not buy health insurance. They paid the penalty. And now by Congress getting rid of this and the president signing it into law to remove the penalty for those people, that's going to basically tear down Obamacare. It's going to lead to the collapse. It's really catastrophic for what was really President Obama's one of his signature legislative accomplishments. So a lot of credit is deserved for the Republicans in Congress and President Trump for doing that.
All right, let's get to the president's tweet now. He writes, based on the fact that the very unfair and unpopular individual mandate has been terminated as part of our tax cut bill, which essentially repeals overtime Obamacare, the Democrats and Republicans will eventually come together and develop a great new health care plan. Will this happen on a bipartisan basis like the president predicts?
Well, you have to give credit to the president for wanting to get it done on a bipartisan basis. It should be done on a bipartisan basis. There are enough Republicans, there are enough Democrats in Congress that want to have a good health care system for our country. The question is, will the Democrats, now that the Republicans have been successful in getting rid of the individual mandate penalty and the mandate, will they want to work with the Republicans? But clearly something needs to be done. Even your most hardcore Democrat agrees that Obamacare had some shortcomings in it. So this is a perfect opportunity for the president to show leadership and for the Democrats and the Republicans in Congress to work together to try to improve upon and to and have a reform that will actually work for the American people.
In your research on this topic, you write, we can expect to see more competitive, smaller government solutions to our health care system. What are those, and what do you mean by that?
Well, I think that one of the problems with Obamacare was that it was a big government solution where you had the U.S. government saying to every American, you have to buy health insurance, you have to pay a penalty to the IRS if you don't. I think there are a lot of reforms that Republicans in Congress have passed in previous years. Speaker Paul Ryan has talked about some of these things, like allowing insurance to be health insurance to be bought and sold across state lines, or other free market competitive oriented reforms that don't involve a big government solution like we saw in Obamacare. So those are the types of things that I think that members of Congress can propose and that you should see advanced in the coming months.
And quickly, one little piece of housekeeping. The mandate does not officially go away until 2019, correct?
Yes, that's correct. It's still in 2018 coming up, a few days away. That's still in effect, but it won't go into the elimination of the penalty won't go into effect until 2019. But once again, this was a central feature of President Obama's legacy, and it's really remarkable that to me that's really a big news story that didn't really get as much coverage because of the tax bill getting so much attention last week.
Justin Sayfie, thank you very much. Have a great day. Time now 19 minutes after the hour.